Hello everyone, I am Dr. Deepak Saha. I am a consultant cardiologist in Medicover Hospital, Begumpet, Hyderabad. Today I will be discussing on a common topic as high blood pressure or hypertension. And of late I have seen that a lot of younger patients are also developing high blood pressures. So is that there is a pandemic of developing hypertension? Yes, if you see the statistics, almost 20 to 25% of patients below the age of 45 years, they develop hypertension. So that means every fourth or fifth person below the age of 45 will have high blood pressure. So it is quite common in my clinic practice that I see patients with younger patients developing high blood pressure. So why these younger patients develop high blood pressures? There are a lot of reasons. One is basically the food habits that they take, lot of salt, junk foods that may lead to high blood pressure. Lack of proper foods and improper way of dieting is also may lead to high blood pressure. Then patients having lot of stress, especially in patients who are doing night duties, duties at odd hours, they also develop high blood pressure quite early in their life. Then lack of physical activity and lack of support both from the family or friends, these are also been shown to increase high blood pressure in these patients. Apart from it, some of the patients are also genetically more prone for developing high blood pressure, especially if their parents are already having high blood pressure. How do we know whether a patient is suffering from hypertension? The best way is to check the blood pressure with a sphygmomanometer, which is a common blood pressure machine. So if you check your blood pressure and it is consistently higher values, there are different values given by different bodies, both in American, European and Indian. But in general, if the blood pressure is more than 140 by 90, that is the upper one is more than 140 and the lower one is more than 90, either of them is more than 140 by 90, then we say that the patient is having high blood pressure. Initially, it may be managed with proper diet and physical activity, but eventually many of these patients will be requiring blood pressure medications to bring their blood pressure down. So how do we check the blood pressure? The ideal time to check your blood pressure either is in the morning or evening. Take at least 2 or 3 times at a time, and the second and the third reading are normally the correct values which will be shown. And if the blood pressure is consistently more than 140 by 90 in 2 or 3 occasions, then we label the patients having high blood pressure or hypertension. So there are various drugs that are available in the market. Depending upon your lifestyle, the blood pressure medicine should be modified to bring the blood pressure down. So what are the benefits of taking medications for high blood pressure? Yes, the important is if the blood pressure is in the normal range, you can avoid lot of complications due to hypertension, like patient developing heart attack, patient developing stroke, that is a paralysis attack, kidney damage, eye damage. These are all various complications due to hypertension, and this can definitely be delayed or avoided if the blood pressure is under control. So my friends, get yourself checked. Even if you are young, get yourself checked at least once in 6 months for the blood pressures. And if your blood pressure are consistently high, please meet your physician or a cardiologist for a complete evaluation of your blood pressures and take your medications if prescribed. Thank you.
అద్భుతమైన ఆరోగ్య వీడియోల కోసం 3TV హెల్త్ ఛానల్ ని లైక్ చేయండి, కామెంట్ చేయండి, సబ్స్క్రైబ్ చేయండి, అలాగే షేర్ చేయండి. థాంక్యూ.